The rainy season, which typically spans from May to October in Nigeria, is a period marked by persistent downpours, waterlogging, and reduced sanitation in many areas. But alongside these weather changes comes an alarming rise in health-related issues, especially in vulnerable populations such as children, the elderly, and individuals with pre-existing conditions. Among the most common health concerns are malaria, cholera, typhoid fever, respiratory infection, and fungal skin diseases. Malaria, a life-threatening illness transmitted by the female Anopheles mosquitoes, tops the list of health threats. According to medical practitioner Dr. Abidemi Akinrotoye, the rainy season provides abundant stagnant water, ideal breeding grounds for mosquitoes, thereby increasing the rate of transmission.
This season you see a lot of stagnant water. Of course, you can see that means you are helping the mosquito life cycle when you have stagnant water in an environment. We could also have some waterborne diseases during this period. Cholera, especially in places where their lifestyle is not that hygienic.
Dr. Abidemi Akinrotoye explains practical ways to prevent mosquito bites, including the use of insecticide-treated nets, indoor spraying, and removing stagnant water around the home.
Wear something that will cover yourself, even for this younger, the children under 5. Make sure that they are well dressed during this period, and even for the elderly too. Make sure that they cover virtually every part of their body so that they can stay alive at this period and it will not come down.
Also contributing to the seasonal health crisis in the contamination of drinking water, which leads to cholera and typhoid outbreaks, private health experts Olu Aladeshulu identify poor sanitation and blocked drainages as leading causes of waterborne diseases during this period.
In Nigeria, in Akure, the capital city of Ondo State, we still have people that use the open dump. So runoff water during the rain flow from there and flow into some streams. It's not every home that you have pipe-borne water. In fact, you don't even have it in so many houses in Ondo State. So if people use open defecation, open disposal of refuse, and water comes from them and goes into the stream, the possibility of sicknesses that are waterborne, like I've mentioned, will be very high.
He warned that stagnant water, especially in urban slums, harbors bacteria and parasites that causes gastrointestinal infections.
It has nothing to do strictly with the season of the rains. If they are elderly, because we mentioned elderly, who smoke, their chances of getting respiratory infection is very high during the cold. Because the air that blows, the lining of the nostril towards the lungs have been compromised. Therefore, they are not as good as when there is nothing. So the possibility of chest infection is also high. They too, every one of us, babies, mothers, young adults, elderly, should be on good food.
Respiratory issues also spike during this season, especially among children, due to damp environments and exposure to cold weather. Skin infections, particularly fungal rashes, are also common because of prolonged exposure to wet clothes and unsanitary environments. A resident at Deshuloro Bosede shared some of her personal preventive tips, ranging from boiling drinking water to using protective clothing and maintaining of clean environment.
In the morning, I will take tea when I'm not fasting. I will take tea. I will use warm water to bath myself. Then I make sure I wear cardigan like as I put on my coats just to cover my chest, just to keep my body warm.
As the rainy season progresses, public health officials are ramping up sensitization efforts to reduce avoidable illnesses. The message remains clear: maintain hygiene, eliminate mosquito breeding sites, and seek medical attention early. They say prevention is better and cheaper than cure. Abidemi Akinrotoye, OSRC News.